the last thing I want to share is the vaccine compliance rate across the state in hospital workers. So the Hospital Association last week, starting on Monday, we ran a survey of all of our member hospitals, and every hospital in the state belongs to the Washington State Hospital Association. But this survey does not include the military hospitals and the state psychiatric hospitals, since they are members of the hospital association, but we didn't include them because they operate in a different realm. So this is the community hospitals. It's the for-profit hospitals, not-for-profit hospitals, small rural hospitals, great big systems, freestanding psychiatric hospitals, children's hospitals. That's who's included. So the really good news is that there's been a significant increase in hospital worker vaccinations in the last couple of months. And so we are today really glad to be reporting that looks like at the moment, we have an 88% vaccination rate statewide. There is variation in that. There are some places that have very high vaccination rates. UW Medicine, for example, is one that does. You can hear from Dr. Dillett about that. And some other places that have much lower vaccination rates. So there's about 12% of hospital staff across the state that are obviously not represented in that 88%. And so it's a mix of people. And some of those are partially vaccinated. So they've started their series. In order to be counted in the 88%, you have to be fully vaccinated, which means that by October 19th, you will have had 2 weeks past either your Johnson & Johnson shot or your second shot of Moderna or Pfizer. So some folks are moving down the path and they may be like a week behind in their vaccination rates. We saw that in New York and California, where people got shots late in the time frame and then are now getting caught up. They may have an approved exemption and an accommodation. In some of the accommodations, some folks might want to talk about this too, that hospitals are offering might be things like providing telemedicine services. So if you have a medical exemption from the vaccine and you aren't going to be working face-to-face with patients, you could do telemedicine. There are also people in this group who either have applied for an exemption or have stated they plan to apply for an exemption that either hasn't been reviewed or the exemption has not been received or fully documented. Like you can apply for medical exemption, you have to have a medical provider's endorsement of your exemption, so that they may be waiting for some of the paperwork to come in. They might not have yet provided, they might be fully vaccinated, but not yet provided their verification. So we got quite a few, I think a surprise of this enforcement recently, or the evaluation recently, was hospitals asking staff who they thought were not vaccinated, were they planning to get vaccinated, and the staff saying, oh yeah, I am vaccinated, I thought I turned in my card, or I just hadn't gotten around to it yet. So there are some folks in that group as well that we think are vaccinated but haven't provided it yet. And then finally, people who are choosing not to be vaccinated. So we don't yet know the full impact of how many staff we will lose statewide. We think it's between 2 and 5% of hospital staff will not be able to work on October 19th, or maybe it could be a little bit later, because we're going to, for folks who are partially vaccinated, who gets their shots this week, for example, I think hospitals are likely to put them on leave, not terminate them, and then have them be able to come back to work as soon as they finish their vaccination series.